A very, very good afternoon to you. This is Talk, the Home of Common Sense. Tom Slater still with me, is editor at Spiked Online. Tom Slater, I mean, does it not still surprise you, we're talking about something completely different from Southport and Donald Trump, just for a change, that the man who was Chief Medical Officer during the entire COVID pandemic, Professor Chris Whitty, is now still the Chief Medical Officer of this country, but now has been knighted, despite everything we now know and what has come out, not just from the COVID inquiry, but also, let's face it, from Matt Hancock's WhatsApps.
I mean, it's incredible. It's not even failing upwards so much as it is failing catastrophically and then being allowed to remain in post, garlanded with knighthoods and so on. And you think that just from the perspective of this is your one job. I mean, the public health establishment, they seem to have convinced themselves that people's waistlines and their habits and what they get up to in their private time is actually their area of expertise and what they should be focusing on. Pandemics, actual public health is where these individuals should be tested. And he failed that test miserably. The fact that he continues to pontificate on these issues, the fact that there's never been any real sort of accountability for the mistakes that he clearly made, is horrendous, but I guess that was always going to be the way that worked.
Yeah, indeed, and that's where we are right now. Well, let's talk about this with Carl Heneghan. He's Professor of Evidence-Based Medicine at the University of Oxford. We spoke to him, as you know, many times throughout the COVID pandemic, and he joins us right now. Good morning to you, Carl. Afternoon, sorry.
Good morning, Julie.
Thank you very much indeed for joining us. Chris Whitty was at the COVID inquiry yesterday. He's done a number of different appearances, but he told the public inquiry that he was sceptical about making COVID vaccines mandatory for healthcare workers. And he said the decision to implement that mandate was 100%, he said, a political one. It would have been useful to know that at the time, wouldn't it, when we saw thousands of certainly care workers being sacked from their jobs, even though many of them had already had COVID, had worked throughout COVID with very vulnerable patients, and sacked. But apparently there wasn't actually any particular medical reason for this mandate. What do you make of that?
I'm really struggling to understand what the purpose is of a chief medical officer. It's supposed to be somebody who's responsible for the medical care of the whole of the UK, or in this case, England, maybe. Now, in doing so, he has to be honest, but coming after the event, somebody now really should be saying, you didn't do your job. And if you look at it, what they did is say every healthcare worker had to have a vaccine. That was going to come into enforce in April 2022, and a month before, they removed it. Now, in doing so, but by November of 21, all the care home workers had to have vaccines and about 40,000 people left their jobs. So actually created more harm than good. But what's really an important issue here is they understood that the vaccine manufacturers were telling them that the payouts could be as high as 300 billion for the harms caused this vaccine. Yeah. And that in doing so, you're still going to go ahead with a mandate. At some point, we have to make sure people are accountable. This COVID inquiry is just like a nice little talking shop. Yeah. There's no prosecution here who comes along and says, I'm sorry, you are accountable for this error. Yeah. Shouldn't you be leaving your job?
Yeah, indeed. And extraordinarily, of course, we know that it was the politicians making the decisions. We know that from the WhatsApps. A lot of it was just done on a whim, by the Health Secretary or by the Prime Minister, or not to be one-upped by Nicola Sturgeon in Scotland. But again and again, we've seen Professor Whitty and other medical experts, and probably these are highly qualified experts, kind of just sort of shrugged and went, well, yeah, we didn't really have any evidence for kids wearing masks for 8 hours all day at school, or we didn't really have any evidence for a mandate, or for kids getting the COVID vaccine, even though, of course, it was JCVI argued that they didn't need it, and they absolutely didn't. But they went along with it. And yet, when they stood alongside the Prime Minister or the Health Secretary, when they made an announcement, they tacitly supported it. The politicians used them for cover, but they never, so we assumed, well, you're thinking it's a good policy, you agree with it. But their job, they were paid by us as taxpayers, they were paid by us to actually give medical advice, and I think, frankly, they should have let us know when the decision was political, not medical.
So this is the important aspect. It's this problem of being at the altar of certainty. In medicine, there are loads of uncertainties. Yeah. It's always about the benefits to the harms. And my job as a doctor is importantly to convey that. Now, I can accept the mathematicians in the world have no idea what I'm on about here, and the modelers. But actually, the chief medical officer job is to stand up and say, honestly, in this situation, there are potential harms that might affect us, and we shouldn't be having a vaccine mandate. clear, and that's my position of chief medical officer, and if the government fires me, fair enough. But if he did that, he would have huge respect amongst the public.
Yes.
We may be talking about a different system that allows us to be honest with the citizens.
And also, again, weighing up the vaccine. Again, the vaccine was only developed, was supposed to be for over 70s, the people who were largely the people who were dying. And everybody should have been given, full evidence. Again, one of the main reasons I got the vaccine, I had elderly parents, one in particular was unwell, and we were told it would help prevent transmission. It seemed to me to be the responsible thing to do, even though I felt no risk whatsoever from COVID at the time. I'd already had it, didn't you? But I thought that might help. Again, I was basically sold the vaccine on a lie. They had no evidence for that statement at all. But this man is not only still in situ, he's been knighted and seems to be sort of shrugging and totally unbothered by the fact that he completely let the nation down. And, children being jabbed unnecessarily, again, even more unforgivable. Can I ask you also there about what went on in America? Because we were we're often downstream what America was doing. Anthony Fauci was the man who was basically, Dr. Anthony Fauci, in charge of sort of advising the president's in terms of COVID policy. There is the former head of the National Institute of Allergy Infectious Diseases. But he basically, he was the man who was saying, this is what we need to do, this is what we need to do. Huge amount of evidence now that he was in charge and helped to fund research that went on at the Wuhan lab in China that was looking into basically COVID, changing COVID viruses and possibly making them more deadly. We know that advice went out. I mean, people were banned from social media, accused of being conspiracy theorists when people said they thought this virus had come from a lab rather than from a meat market and by a wet market by accident. This man has now been given a full pardon for any possible future criminal charges brought against him for this period by Joe Biden, the outgoing US president. Why on earth would he need such a thing?
Well, I think the biggest mistake in the issue is that actually he went to a Senate hearing committee and he said the NIH has not and does not fund gain-of-function research. And then what happened is it came out that actually they totaled of $8 million worth of research, of which 600,000, went to the Wuhan Institute. So basically, the biggest criminal offence I think he did, which in the US, if you lie to Congress, that is a serious offence. So that's why he's been pardoned, to allow him to get away with that. But it's also backfired, I think, because it's shown you the problem of people like Fauci, who said the vaccine was a dead end for the virus. Complete misinformation and actually ridiculous. But he was pushing it at the time with the mandates. Yeah. Now, the other thing, though, we could learn from America, which I think is interesting, if you look what happens in America is they appoint their own people, like their chief medical officers, with the incoming government. And they people are political and live and die by that government. I do think we would get a better accountable system than just letting our advisors and our civil servants lie there and do what they want with no accountability.
Being accountable. I just think they should be accountable to us rather than to the prime ministers they advise. I think that should be the key thing, shouldn't it? Carl Heneghan, we'll have to leave it there. Time's against us, Professor of Evidence-Based Medicine at the University of Oxford. No, Tom Slater. I mean, it is just absolutely shocking what's happened with Fauci, isn't it? I mean, he has absolutely got away with this.
I know, and the fact that Joe Biden was willing to hand him this pardon, I mean, it's only going to further fuel people's scepticism about the way in which the government dealt with this and them covering each other's backs.
And this isn't a conspiracy theory. There is so much evidence for this. It's extraordinary.